plus. O-positive blood shows a part of the blood cell called the H antigen. Because this part is uncovered, germs can grab onto it more easily. This makes people with O-positive blood get sicker from stomach bugs like norovirus or cholera because the germs can stick to their blood cells faster. People with O-positive blood do not make as much of the stuff that helps blood clot and stop bleeding. When they get hurt, they bleed for longer, bruise more easily, and can lose more blood in accidents or surgeries. Moms with O-positive blood also have a higher chance of bleeding a lot when they have a baby. A germ called H. pylori can stick more tightly to the stomach of someone with O-positive blood. This germ can cause painful stomach sores called ulcers. People with O blood are more likely to get these sores, and they can bleed or cause big stomach problems. People with O-positive blood react to stress more strongly. Their bodies make more stress hormones and have a harder time calming down. This can make their heart beat harder, raise blood pressure, and make the body feel tired or achy more often. Certain parasites, like hookworms, can attach more easily to people with O-positive blood. These parasites take the person's blood, which can make them weak, tired, and low on iron. Mosquitoes like the smell of people with O-positive blood more than other blood types. This means they get bitten more often, which can give them more mosquito-carried sicknesses like dengue or West Nile virus. People with O-positive blood can have stronger immune reactions that sometimes go the wrong way. This makes them more likely to get sicknesses where the immune system attacks the body by mistake, such as thyroid problems. If an O-positive mom has a baby with a different blood type, her body can sometimes attack the baby's blood cells. This can make the baby sick after birth and can cause yellow skin or low energy. People with O-positive blood also have fewer protections that come from A or B antigens. Because of this, they may have a slightly higher chance of getting certain cancers, like stomach cancer. A plus A positive blood has the A antigen on it. Some germs can stick to this antigen more easily, which helps them get inside the body and cause infections faster. People with A positive blood have stickier blood. This means their blood can form clots when it shouldn't. Clots can block blood flow to the heart or brain and cause big problems like heart attacks or strokes. A positive blood is linked to more inflammation. Inflammation is when the body acts like it's fighting something all the time. Too much inflammation can damage organs, cause joint pain, and make the person tired more often. People with A-positive blood can get stomach problems because the germ H. pylori can attach more tightly to their stomach lining. This increases the chances of ulcers and stomach cancer. A-positive people may also get sicker from breathing illnesses because their immune system can react too strongly in their lungs, making swelling and breathing trouble more likely. People with A-positive blood also have more allergies because their immune system sometimes reacts too much to pollen, dust, or food. This can cause sneezing, itching, or asthma symptoms. Their bodies also handle stress differently. They hold onto stress hormones longer, which can make them feel worn out and anxious more easily. B plus B positive blood has the B antigen on it. Some germs use this antigen to latch onto the body, which helps them spread more easily. B-positive people sometimes have a weaker first response to new sicknesses. This means germs can grow more before the body starts fighting them. B-positive is less common, so in emergencies there might not be enough matching blood for them if they need a transfusion. People with B-positive blood process sugars and fats differently. This can make weight gain, tiredness, or blood sugar problems more likely as they get older. Some bacteria and viruses stick better to B blood, raising chances of throat or lung infections. B-positive blood can create more inflammation inside the body. Too much inflammation can cause stomach problems, joint pain, and slow healing after illness. If a B-positive mom has a baby with A or O blood, her body can sometimes attack the baby's red cells. This can make the baby sick or yellow after birth. Mosquitoes sometimes bite B-positive people more often, increasing their chances of mosquito sicknesses like dengue. Their blood may also become sticky in the wrong places, which can raise the risk of small clots forming in veins or arteries. AB plus AB positive blood has both A and B antigens. This gives germs two different places to attach, making some infections easier to get. People with AB positive blood have the highest chance of blood clots out of any blood type because they carry both A and B antigen traits. This makes heart attacks and strokes more likely. AB positive individuals are at higher risk for memory problems later in life. Some studies show they have more trouble with thinking and attention when they get older because of how their blood affects tiny blood vessels in the brain. Since AB positive is very rare, Hospitals often don't have enough blood for them in emergencies. This can make surgeries or accidents more dangerous. They can have stronger inflammatory reactions, which can make infections or sicknesses more painful and harder to heal from. A B-positive people also show higher chances of certain cancers because their body has both A and B antigen patterns that can interact poorly with long-term inflammation. Their immune system can be confused more easily, especially with viruses. Sometimes their body doesn't know how strongly to fight back, allowing viruses to grow faster. O negative blood shows the H antigen, but has no A, B, or Rh markers. This makes germs stick even more easily, especially stomach bugs like norovirus. People with O negative blood have the lowest clotting factors. This makes bleeding extremely dangerous for them. Even small injuries can cause big bruises or long bleeding times. O negative blood is very rare, so there is often not enough of it available in emergencies. If an O negative person needs blood, it may be hard to find. They are also more likely to get stomach ulcers and severe stomach infections because germs grab onto the H antigen more easily. O-negative people get mosquito bites more often, which increases their chances of mosquito diseases like Zika or dengue. Moms with O-negative blood have the highest risk of pregnancy problems if their baby is Rh positive. Their body can attack the baby's blood cells unless they get special shots. Their immune system can also overreact and cause autoimmune problems like thyroid disease. A negative blood has the A antigen, but no Rh factor. Some germs use the A antigen to attach more easily, making infections harder to avoid. People with A negative blood have stickier blood, which raises the chance of dangerous clots that can block blood flow to the heart or brain. A negative is very rare, so if they need a blood transfusion, hospitals may not have enough matching blood. Without the Rh factor, pregnancy can be risky. If an A negative mom has a baby who is Rh positive, her body can attack the baby's blood cells. People with A negative blood can have more inflammation and more allergies because their immune system reacts more strongly than it should. They can also have more stomach problems from germs that stick to the A antigen. Stress affects A negative people more deeply because their body holds onto stress hormones longer. B negative blood has the B antigen but no Rh factor. Germs that attach to the B antigen can infect these people more easily. B negative is one of the rarest blood types, so there is often not enough matching blood in hospitals for them during emergencies. Their immune system sometimes reacts too slowly to new infections, which gives viruses and bacteria a head start. People with B negative blood process fats and sugars differently, which can lead to weight problems or tiredness over time. Without the Rh factor, B negative moms can have pregnancy problems if the baby is Rh positive, because the mom's body might attack the baby's blood. B negative people can also have more inflammation in their joints and stomach, because their immune system stays active longer than needed. Their blood can form sticky clots in the wrong places, raising risk for heart or lung problems. A B negative blood has both A and B antigens and no Rh factor. This gives germs more ways to attach and infect. A B negative is the rarest blood type, so it is very hard for hospitals to find matching blood for them in emergencies. People with AB negative blood are the most likely to form dangerous blood clots because they have both A and B antigen traits without the Rh factor. These clots can block blood flow and cause serious problems. Their immune system can get confused and not fight infections fast enough, allowing sicknesses to spread more quickly in their body. AB negative blood is linked with higher chances of certain cancers because their body has both antigen patterns that can cause long-term inflammation. People with AB negative blood often have more memory or thinking problems later in life because tiny blood vessels in their brain can get blocked more easily. Without the Rh factor, AB negative moms have pregnancy risks if the baby is Rh positive. Their body may attack the baby's red blood cells. Human defect revealed. Subscribe for the next one.